Today I'm going to talk about ACL tears and how to treat them. Hello, I'm Dr. Leon Popovitz. Welcome. Anterior cruciate ligament is, or another name is ACL, is a central ligament inside the knee. So basic anatomy, top bone, bottom bone of the knee, and here's the kneecap. I'm going to open up the kneecap and you can look inside the joint. The ends of the bone in the joint have this smooth layer of cartilage, like an eggshell, both sides, even the kneecap. In between the two bones are these menisci, the meniscus on the inside, on the outside. There are cushions that protect the lining of the bone, this cartilage at the bone. Two major ligaments are in the center of the knee, the ACL, anterior cruciate ligament. Anterior means front, cruciate is crossing because it crosses with the other ligament, and obviously ligament. And then there's the PCL, posterior ligament, which is the ligament in the back. Very common to tear an ACL during a non-contact sport such as soccer, when you're making a sharp turn, or if you're rounding second base and you turn the wrong way. These are usually stop and go kind of awkward movements when you're moving fast and you make an awkward movement to try to stop. Usually that results in an anterior cruciate ligament tear, ACL tear. For the most part, if an anterior cruciate ligament, someone suffers an ACL tear, it creates instability. When it first occurs, people usually develop very sudden swelling. Sometimes you may feel a pop. Long term, there is instability where the knee starts shifting because you don't have that same stability ligament keeping it still. So the knee usually shifts forward. As a result, this movement grinds through the meniscus and often results in a tear of the meniscus. When the meniscus tears, that portion of the meniscus essentially dies because the blood flow becomes limited, and you lose a level of protection for the articular cartilage. That results in the articular cartilage flaking off, bare bone starts showing, and that is arthritis. So the goal when someone has an anterior cruciate ligament tear or an ACL tear is to stabilize the knee to prevent further tearing of the meniscus and prevent premature arthritis development. In addition, it stabilizes the knee so you can actually enjoy activities or cross the street without feeling like your knee's going to buckle, and you can actually function normally. So our goal when there's an ACL tear is to return the patient's function, the person's function, stabilize their knee, and to prevent long-term degeneration of the joint. Typically, this is a procedure done for younger people. Number one, as we get older, our joints get a little stiffer. It's less likely that a sharp non-contact pivoting activity will create a tear in the ligament. So it typically occurs in younger people. Also, older people very often may already have the beginnings of arthritis. But typically, we do this for younger, active people. How we do it is the following. In the past, many, many decades ago, it was attempted to repair the ACL back onto the bone. The ACL can tear through the middle of it, can tear through the bottom attachment or the top attachment. It used to be that the attempts were made to repair the ligament, often back onto the bone here or here. When attempts were made, very often it failed because a simple repair back on the bone did not heal. So in time, a reconstructive method was developed. The reconstruction was to take a ligament, harvest a portion of another part of the knee, and implant it in where the torn ACL existed. The most common place that we harvest that tissue is from the front of the knee, the patellar tendon. We usually just take a third of this. We take a portion of the bone above and a portion of the bone below, and we take the central third, and then we implant it into the joint where the previous ACL was torn. The part where we harvest the ligament or portion of ligament, a portion of the tendon in this case, is an open procedure. When we put it inside the knee and fix it inside the knee to replace it, that's a arthroscopic procedure where we can do it through a telescope and micro incisions. So that procedure has been developed many decades ago and has really become the gold standard of ACL reconstruction and fixing ACL tears. In time, other grafts have been used. Some people use the quadriceps tendon above. Some people use a hamstring, a portion of the ligaments over here. My personal preference is the patellar tendon here because we use a portion of bone above, portion of bone below, and we fix it bone to bone. There it has a greater, stronger fixation. More recently, in the last couple of years, an ACL repair has been reevaluated and optimized. And what more recently things are being used for ACL repairs, not the reconstruction, but actually repair the ligament back onto the bone, is using a scaffold. So there are actual structural sutures that are used to repair the ligament, and the sutures themselves are so thick and strong that they're used as a scaffold, just like you would have a scaffold in a building, so to allow a secure place for that ligament to heal back onto the bone. And it's become relatively popular. The only thing is that it's not for everyone. Ideally, it is only used, or should be used, for what's called an avulsion right at the bone, right where the bone comes off. So I'm going to use a pen instead of my big finger. So that ligament can tear off of the bone or avulse off the bone or even take a piece of bone with it. That's the ideal candidate for someone to have an ACL repair, because usually the tissue is nice and thick and healthy and big and can be put back on, and the likelihood of healing is much higher. If the tear occurs through the mid-substance, it's not a good candidate for an ACL repair because there's not enough tissue and we have to pull that tissue all the way up here. If the tear is off of the bone here, again, not enough tissue to be brought up there. Some ACL injuries occur when the bone itself cracks over here. That has always been fixed with an actual repair back onto the bone. But here we're talking about a repair where it's above the bone and it's in the mid-substance or in the actual tissue itself, which is the vast, vast majority of ACL tears. Those have been attempted to be repaired again. Ideally, it has to be someone with an avulsion or a rip off of the bone above. But even in that case, if you are a high-level athlete, or if you're a professional athlete, or if you have very high demands, really it's probably not the ideal procedure for you. Personally, I would stick with the gold standard, using a reconstructive procedure where we take the tissue from here and then ideally the bone patella tendon bone and implant that, because that has had decades and decades of shown great success. Right now it seems a little bit of a risk to proceed, if you're a high-level athlete or high demand person, to proceed with just a repair, even if it is an avulsion above, right above at the attachment. Still, every case is individual, every case is unique, so it's hard to generalize, but these are my general evaluations of this new procedure. I'm Dr. Leon Popovitz. I hope this was very helpful and educating. Thank you so much for your time.